Good afternoon, dear colleagues and chairperson. First, I want to thank the organizing committee for giving me the opportunity to present remotely at this important conference, at this important scientific conference. My talk today, the title of my talk is From Micron to Nano, Beyond Light Microscopy. Electron microscopy identifies potentially predictive morphological morphological changes for hepatocellular carcinoma. In the few minutes, I will discuss how transmission electron microscopy can reveal biological changes beyond the limit of conventional light microscopy and their potential clinical significance in hepatocellular carcinoma. As we know, the increasing incidence of hepatocellular carcinoma in patients with chronic hepatitis C highlight a major diagnostic challenge. The major challenge we face is that early malignant transformation is often missed because the conventional radiological follow-up technique failed to detect small early malignant lesion of about 1.5 centimeter and usually require biopsy. The differentiation of regenerative active nodule and highly dysplastic nodule from early malignant cellular transformation remain largely subjective by light microscopy, leading to potential underdiagnosis of early malignant turnover. What we see using light microscopy, mainly we focus on architectural distortion, cell density, and cellular atypia. All these criteria, there are many criteria that we look for, but many of these criteria do not have absolute measurable limits. For example, trabecular thickening is commonly described as more than 3 cell thick, but borderline cases are frequent. Endothelial wrapping may be focal. Also, cellular density and loss of orientation are visually estimated rather than objectively quantified. Nuclear atypia, hyperchromesia, and polymorphism exist on a spectrum as mild, moderate, and severe. This is the judgment of the pathologists. There is no sharp cutoff where cells suddenly become malignant. Usually, we face overlap between dysplasia, especially highly dysplasia, and early HCC, because there is no universal cutoff for mitosis per high power field that clearly separates hepatic dysplasia from HCC. For this, liver pathologists rely more on an assembly of findings. Usually, mitosis to become more frequent, especially in case of increased cell density, trabecular thickening, stromal invasion, diffuse atypia, endothelial wrapping. When all these parameters join together, the pathology or the lesion will be relatively late morphological manifestation of malignant transformation. For this, usually for the detection of early malignant transformation, pathologists depend on his own experience and interpretive judgment. For this, in the study, we use the transmission electron microscopy to go beyond light microscopy and explore ultrastructural predictors of HCC in contrast to the subjective light microscopic parameters that largely depend on pathologist interpretation. My talk will go through these 2 points: the incorporation of transmission electron microscopy techniques with light microscopy to explore structural and morphological details that were otherwise inaccessible, establishing reliable ultrastructural criteria that can assist in early prediction the onset of HCC in high-risk patients. The plan of this work focused mainly on the comparison between the development of experimentally gradually induced HCC in mice using dimethylnitrosamine, and the group of mice were sacrificed at the interval of 4, 8, and 16 weeks, and compared with liver specimen of surgically resected HCC over existing HCV. and also compared to the pre-malignant lesion of the corresponding surgical safety tumor-free resection margin, and ultrasound-guided liver core biopsy, about 20 samples from patient positive for HCV and of stage F4. The normal control, as usual, we have normal control of mice, and the normal control of human would depend on the normal data, the data present in the literature. This is light microscopic of the studied cases. I'm sorry, I want to remove this part. The criteria predicted the the main findings of the study are summarized in these two tables, which demonstrates the proposed criteria for predicting the shift toward malignant transformation. This is deduced and concluded from the examination of the experimentally induced HCC, human HCC, and the freeze tumor surgical margin specimen in comparison with the liver needle biopsies. We have deduced 5 relevant or major observable morphological criteria observed in the examined cases and 7 subsidiary morphological criteria. The 5 relevant morphological criteria, or the main one, the first one will increase in cell density. With the progress of tumor induction, the turnover of hematoxylin and leucine-stained hepatocyte from acidophilic to basophilic cytoplasm reaches its maximum density in 16 weeks exposed mice to DAN. This change on the level of AM was evident at the 4th week of exposed mice to DAN. Increased cellular density is not just a visual feature. It reflects biological transformation in the form of high metabolic activity, increased rough endoplasmic reticulum, and ribosome, active mitochondria, and protein senses to support rapid growth and division of the cells. The second observed criteria is the change in ductal reaction and the loss of polarity, and the increase of the intermediate hepatic-like cells, progenitor cell in the studied field. Hepatocytes lose their 2 main polarized domains, the apical canalicular domain, which is one of the domains that we search for as a sign of pathological changes. This side send bile. This side is present the bile-kind nucleus with tight junction of the hepatocytic interface, and the second domain is the basolateral domain or sinusoidal domain. This is lost during the transformation of hepatocyte cell to malignancy. Here we can see newly formed bile ducture in between hepatocytes with an oval cell here seen in the field. Also, canalicular ductal junction or ring canal formed by the junction of the hepatocyte with the biliary epithelial cells. Oval cell is seen in the vicinity of its basement membrane. Here it is the bile canal nucleus bordered with more than 3 hepatocytes and intermediate hepatocyte of progenitor cell origin, showing oval nucleus perpendicular orientation here, and increase of intercellular junction. This changes is also detected in the case of tumor-free surgical margin. Here's bicanuclei bordered by more than 2 hepatocytes. Bicanuclei, as is another one here, with increased junctional complex along the cell membrane interface. Canalicular ductal junction lined by 2 by two intermediate hepatocytes and two ductal epithelial-like cells. A case of HCC group of small-sized hepatocyte of early well-differentiated HCC showing loss of polarity with increased nuclear cytoplasmic ratio arranged around the vascular space, giving a picture of pseudo-acinar pattern. Here, progressive HCC showing bizarre-shaped nuclei with condensed heterochromatin seem to be a result of uncontrollable division of intermediate hepatocyte of progenitor cell origin. The third proposed criteria for pre-malignant diagnosis in the presence of unpaired arteriole. This is unpaired arteriole in 16-week then exposed mice, newly formed small vessel, the endothelial lining protruding is a lumen mimics that of small arterioles. This is the wall, is elastic tissue here. Also, this is also seen in cases of free tumor surgical margin, the impaired arteriole, which is a sign that recurrence will be within 1 or 2 years. This is the impaired arteriole in case of HCC, and this figure demonstrates morphological configuration of 16 weeks then exposed mice, format of intermediate hepatocytic progenitor cell with increased cellular nuclear cytoplasmic ratio, forming trabeculae of more than 3 cells thick. One of the main important findings in this study is the observation of abnormal regenerative mechanism. We call it clonal fragmentation. Here's in the hepatocyte, which doesn't look like apoptotic or necrotic, which is split into pieces, a star shape with rod shape or round or rod shape electron dense particles with presence of fibri here and podocyte for mobility. Detached part from hepatocyte forming bile nuclei. Here we can see the detached part, the detached part here, we can see bile nucleus from the detached part from the mother cell. Here, bile nucleus with the mother, not the site. Here we can see the site of cleavage between both. These cells seem to undergo specific kind of primitive form of regenerative cell division or splitting comparable to the division mechanism reported in starfish. The splitted cell did not disclose any criteria of apoptotic exchange or necrosis, as I told you. This is a picture of this star-shaped mobile separated part of the mother cell. This star-shaped cytoplasmic mass was seen also in 16 weeks then exposed mice. Also, we saw them in tumor-free resection margin and in the diagnosed regenerative nodule, as we have seen it now. Also in as in separated star-shaped part from the hepatic progenitor cell in HCC. The 7 subsidiary morphological criteria that we proposed as can be marker of turnover to malignancy, hepatocyte turnover to malignancy, the formation of lipolysosomes with small-sized mitochondria, the marketed fat droplets with monotonous with fibril, like here. I see mitochondria with deep matrix, This is an SCC, progressive HCC, tumor-free resection. This is from tumor resection, free resection margin. This is a sample. This is 16 weeks then exposed mice. Increase intercellular junction between a hepatocytic membrane or along bile canuculi. Increase the intercellular junction and along the bile canuculi. Also, liberated cellular rough endoplasmic reticulum, dilated, distended with proteinaceous material, the present autophagosomes. Also, another observation is the presence of sequestrated nucleus with granular material, proteinaceous granular material, the ribosome, and the microfilament. This is the case of regenerative nodule. It is from 16-week then exposed mice. We propose that hepatic pre-malignant ultrasound, we propose a score to assess the turnover of hepatocyte to malignancy. This score is, we call it hepatic pre-malignant ultrastructure scoring index, HYPA-C. These presumed pre-malignant morphological features should not be interpreted individually, but rather assessed collectively through a unified scoring approach. The proposed scoring model consists of two categories, 5 major criteria and 7 secondary observations identified in this study. In the first category, each criterion is scored as either 0 or present 3, while in the second category, each observation is scored as absent or present. By its value would be 1. The total combined score range from 0 to 22. And we can make a graph. It can be visualized as a graph. Carry-home message. We are not suggesting replacing light microscopy. We are highlighting that structure alone may not be enough when the disease starts at a biological level. Cancer begins as a biological transformation before it becomes a structure. Then relying only on light microscopy means we are diagnosing it late. Electron microscopy usually equal potential bridge toward objective ultrastructure predictors. In the same time, electron microscopy, In the same time, electron microscopy bridges the gap between invisible early biological transformation and radiologically evident disease. Adjunct electron microscopy with light microscopy biopsies is advised in 3 scenarios. Free tumor resection margin in case of resected SCC or cirrhotic regenerative nodule should be examined for detection of any pre-malignant changes. Inconclusive biopsy between dysplasia and early SCC. Suspicious lesions in HCV with active regenerative nodule. Attention should be paid to the tumorigenic ability of hepatic stem cell progenitor cell in liver therapeutic field. This study visualized a primitive mode of cell division that may represent an underlying mechanism contributing to malignant transformation. The study also shed light on some possible predictive factor of HCC, but an overall understanding of the mechanism inducing malignant transformation remains a challenge. Patients with HCV underwent surgical resection SCC or having a cirrhotic liver with active regenerative nodule must be subjected to an appropriate surveillance. Hepatic pre-malignant ultrastructure scoring index is proposed by the study based on 5 major criteria and 7 secondary observations that need to be systematically evaluated to predict early malignant transformation. At the end, I want to thank my colleagues who contribute with me to accomplish this work. As the end, never lose hope. I believe that never lose hope. Life always finds a way. Thank you.